Hello, I'm Dr. Elliot Hirshhorn of New Life Functional Neurology and Endocrinology in Greenville, South Carolina. We focus on helping patients suffering with chronic conditions like thyroid disease. In this video, I'm going to discuss why TSH is a bad way to measure for thyroid problems and how you're missing 90% of the thyroid puzzle if you're just relying on that alone. Many people with hyperthyroidism tell me that they still have low thyroid symptoms even though their lab tests keep coming back normal. Has this happened to you? Have you been trying to figure out why the numbers are normal but you still have symptoms? Have you been able to get any answers from your primary care provider? There is a huge issue with the traditional standard of thyroid care in medicine that makes this situation all too common. The TSH, or the thyroid stimulating hormone, the so-called gold standard in medicine to assess for thyroid function, is very incomplete by itself. A comprehensive thyroid panel is necessary to get a thorough clinical picture in regard to thyroid dysfunction. I do a full comprehensive thyroid panel to identify the exact underlying physiological mechanisms that are driving your symptoms. There are over 20 different patterns of thyroid dysfunction that we can potentially see, and only this complete panel can identify which particular patterns that you may have. So let's discuss each of these tests on the panel and what they specifically indicate. TSH is, of course, part of our panel. It's very helpful, but not in isolation. Low TSH can indicate hyperthyroidism or Graves' disease, an autoimmune condition. If low TSH is associated with a low T4 level, it may be a neurological pattern in the brain that needs to be further investigated. High TSH with low T4 or T3 levels can indicate hypothyroidism, but looking at other markers is important to determine why. Total T4 and total T3 markers indicate how much actual total thyroid hormone is in your blood, both the amount bound to carrier proteins and also the amount free in the blood. T4 elevations associated with low TSH is a hyperthyroid situation. Low T4 with low TSH indicates a pituitary hypofunction causing hypothyroidism, but with a high TSH it can mean hypothyroidism from some other cause. Too little total T3 can be due to underconversion of T4 into T3 in the liver or in the gut, due to pathologies in those organs, or functional issues with things like cortisol or inflammation. Synthetic hormone replacement for thyroid can supersaturate the thyroid binding sites, causing resistance to the hormone, which creates sometimes a need for higher and higher doses of medications. Even if this is the case, your free thyroxine index, or FTI, should be in the normal range if your thyroid is functioning normally. If FTI is off, then it can indicate hyperthyroidism or other metabolic conditions, but only in association with other lab markers. Free T4 and free T3 indicate how much freely circulating thyroid hormone is actually available. Alterations in free T4 can be caused by changes in the levels of the carrier proteins that transport the thyroid hormone in the blood. Low free T4 can also indicate insufficient medication levels or too much T3 hormone replacement. Free T3 can be too high if the receptor sites are resistant due to inflammation or cortisol, or low vitamin A, or even too low generally in hypothyroidism. T3 uptake is the best indicator for actual free T3 available for usage by your cells. Altered T3 uptake can be due to certain medications or even hormonal imbalances. Thyroid binding globulin is the protein that carries the thyroid hormones T3 and T4 around in your blood. It can be elevated or depressed by things like medications, infections, chronic disease pathology, and even stress from surgery. When thyroid binding globulin levels go up or down, it can alter the free levels of both T4 and T3 in the opposite direction. Some of the most important markers I run, however, are the thyroid antibodies. Autoimmune disease is the #1 reason for hypothyroidism in the United States, but it often goes undiagnosed and unaddressed in the medical standard of care. As you can see now, there are many different blood markers that are critically important to evaluate your thyroid function. When looking at these numbers, I also interpret them with more sensitivity and specificity using functional lab ranges rather than the standard lab ranges. If you have thyroid symptoms and you want to know which patterns of dysfunction you may have and how I can help you, contact my office today at the phone number below to schedule a consultation to see if you qualify for care. Thank you and have a great day.